Hello everyone, I'm Jim Longworth and welcome to another episode of Triad Today, coming to you from the Senior Botanical Garden. We'll tell you more about them later on, and later on is when the roundtable shows up and we'll get into all sorts of controversial topics, so stay tuned for that. Between now and then, some great information coming your way, and so we hope you'll be with us for the entire half hour. But where we want to start is with a recurring guest. That's what we say in television when somebody keeps coming back. That's a fancy word. No, my good friend, Dr. Christine Murray, is Director of the Center for Youth, Family, and Community Partnerships at UNCG. Does a lot of great things for the community, inside and outside the campus. Welcome back.
Thanks again for having me here.
Now, remind folks who maybe just moved into the area or haven't seen the show what your mission is.
So the mission of our center is, which is the Center for Youth, Family, and Community Partnerships at UNCG, and our mission is to build community partnerships that help bridge research, practice, and policy that promote health and well-being for adults, children, youth, and families across the lifespan.
Now, I understand you have an anniversary for the center. Tell me about that.
Yeah, that's right. So the center was actually founded in 1996. So 2021 has been our 25-year anniversary, which is really just an amazing piece of that. I've only been the director for 2 years, so I'm only a small part of that history, but I'm honored to carry on that tradition and celebrate that anniversary.
Why is it so important for the community to celebrate this particular anniversary?
Yeah, sure. Well, I think that the Center for Youth, Family, and Community Partnerships at UNCG really is a great representative of all of UNCG's commitment to partnering with the community, to sharing resources, expertise with the community to help address different social issues in the community. And in fact, the center has been a huge asset and resource for the university. Since 1996, when the center was first founded, the center's brought in over $50 million in funding with contracts and grants across, I believe it's over 300 different projects funded by over 100 different sponsors. So we're really proud to be continuing that work. And of course, the center has a long legacy, but also is just really one part of UNCG's broader mission to be a great citizen of the community and really across the state of North Carolina.
Yeah, that's right, because it wasn't too long in the distant past. A lot of universities were just sort of isolated, either by design or by accident, or the communities didn't feel connected. And yet you've really bridged that gap to let people know that you're working with communities to strengthen them. And that goes with, like you said, with your mission. Give me an example of a community partnership, because we throw around these terms. Give me a couple examples of what you mean.
Sure. So we are all about community partnerships within our center. I would say there's really virtually no work that we do in the community that's not done in partnership with at least one, and usually we're working very closely with different networks of different partners. So sometimes they're kind of smaller scale, one-off partnerships, so coming together to do a training in the community or a parenting workshop, for example. And then other times we build really multi-year, long-term partnerships where we develop resources for either our local community or across the state. So for example, it might look like a training program for mental health professionals and service providers across the state of North Carolina.
That's great. Now, what are some of the social issues that you're currently tackling and dealing with at the center?
Yeah, sure. We address a lot of different issues. I would say right now our programs typically center mostly around promoting positive early childhood development, healthy relationships and families, mental and behavioral health, and then also addressing work within the juvenile justice system.
Now, we didn't rehearse this, but let's sort of backtrack, because we're not really backtracking. We're still in the throes of the pandemic, hoping to come out of it. But how has the pandemic affected relationships, the way you've had to help families, youth, and various people? What do you think?
I think it's had a huge impact on relationship and families, and we've seen that across the board with our different programs, especially for children and young people, just seeing the social, emotional, and the developmental impacts that it's having, and then what does that look like and how it kind of reverberates across the family and really the community as well.
Yeah, transitioning very quickly from all of a sudden we're locked down, and maybe we're not locked down, and we're getting vaccinated, and boy, how stressful for everybody, but glad that you're on the job helping us deal with these kind of things. Up on screen, this website, CYFCP, which stands for the center's name, cyfcp.uncg.edu. And the general website for the university is uncg.edu, and we hope you'll check out both of those. Dr. Christine Murray, don't be a stranger. Thanks for coming.
I'll be back anytime.
All right. We're back now on Triad Today, and always glad we can spend a few minutes with this lovely lady who stopped by to tell us about some great things that True Liant Federal Credit Union is doing to support the community, as always. With me right now, our friend Renee Rohr. She's Community Engagement Manager for True Liant Federal Credit Union. Welcome back to the show.
Welcome. Thanks for having me.
Now, you recently opened applications for two different programs that I want to talk about. I want to get you to tell me about. One is a financial education grant. So let's start with that. We'll come to the other one in a second. Let's start with the financial education grant. What is that all about?
Sure. So financial education grant program, in the last 5 years, we've given away $200,000 to public school teachers grades 6 through 12 who wish to incorporate financial wellness topics in their lesson plans.
Wow.
And so this year we're offering that again. Deadline is November 30th. And we're actually adding special priority this year to teachers that are teaching the new economics and personal finance part of social studies curriculum.
How about that? All right. Now, the other one that you've opened applications for is just this, it's a scholarship program. So give me some details about that.
Great, absolutely. So we offer scholarships for True Liant members who are high school students entering college, community college, or university for their first time next fall, 2022. And their scholarships of up to $1,000.
$2,000.
Exactly. And we, simple application, but we look at academic performance, work history, community activities in our decision making.
Now, I don't want to put you on the spot, but now, do you have a finite number that you're going to be able to give out for those scholarships? Or do you decide that later? How's that going to work?
Well, we typically do 20 $1,000 scholarships, and so we'll still be evaluating what we'll do this year.
All right. Now, let's talk sort of the big picture here. Why does your team and True Liant invest so much in education?
Hey, it's a great question. Investment in education, we believe, is an investment in your future. We know that adults can be financially independent and self-sustainable if they have tools and resources to make them successful, such as education, which is why we think it's such an important part of our commitment to the community to invest in education, and that be from high schoolers up to college-age students, up to teachers who are providing the education.
Sure. And from a purely selfish standpoint, you're helping to create a really good qualified labor pool of kids that are going through that get these scholarships and maybe end up working for True Liant. So,
Exactly.
You're helping to create a team for the future. Let me put you on the spot because I'm interested, since you said that this is not a brand new program. You've been doing this for several years. First, let's start with the financial education grant. What kind of feedback have you received from teachers? You don't have to share any names or anything, but just overall, what kind of feedback have you received on it?
Yeah, that has been overwhelming for that particular program. We hear from teachers in school systems that there's really nothing like that, like what we're offering. That is the niche of financial wellness or career development opportunities for them. And so, every year we get, tons of applications from across our footprint here in the Triad, and teachers just very excited to receive those grant dollars.
I bet, yeah. Now, we'll switch back to the scholarship program. Have you got any way to measure feedback from students who have gotten scholarships, parents who have gotten excited about it? Any sense of how that's been going?
Yeah, we've given away 150 scholarships in the last 10 years, and we do hear from our students. Our students come back and tell us how excited they were to receive the True Liant Scholarship. Parents are very grateful for this opportunity, of course, because they're usually paying for college.
Oh, yeah, and it's not cheap.
No, it is not right now, of course.
Yeah, all right. For more information, I'm going to put this general website up on screen, though, www.trueliantfcu.org, stands for trueliantfcu.org. Please check that out, again, for general information about the company and all the great things that are going on and what's happening in the community. But Renee, to you and your team, I can't thank you enough for what you're doing for the teachers and for the young people and for the parents. So we appreciate it.
Thank you. We appreciate this opportunity.
All right. We'll be right back after this. Back now on Triad Today, and always glad we can spend a few minutes with some good folks from Mountain Valley Hospice and Palliative Care, and one of them is here with us right now. Sarah Tavery is Senior Director of Philanthropy at Mountain Valley Hospice and Palliative Care. Welcome. Good to see you.
Thank you, Jim. So great to be here.
You're new to Mountain Valley Hospice relatively, but certainly not new to the area because you've been around serving the public in so many great ways and know the area. Give me just a quickly a little background on what you've been doing until you got to Mountain Valley.
Sure. So before I joined Mountain Valley, which was about a month and a half ago, I was with Trellis Supportive Care for 5 years and most recently there as their Director of Annual Giving. Before that, I have some experience in marketing and advertising in the financial services industry.
Right. So you came raring to go. Now, let's explain to folks, when we throw out a term like philanthropy, what does that mean in terms of your job? What will you be doing with that?
Okay, so at Mountain Valley, my primary responsibility is to oversee all the fundraising activities for the organization. And I'm so excited to be able to get to meet our donors because they are such an important part of our mission.
Yeah, and with Mountain Valley, they don't turn away people, and it's very important for people to give. Isn't that really part of it's part of the mission, so that's why it's so important when you talk to the donors at your meeting to say, thanks for giving, and it's very important. A lot of times people think everything's fully funded and we don't have to worry about donations, but you do have to worry about it.
That's right. It's very important. So we have a charitable care program, and for that, we really rely on community support, and that's where donations are so important because most of our patients do have their hospice care paid for by Medicare,
That's
Medicaid,
right.
and private insurance.
Right.
But there are a lot of patients who don't have that coverage. And for those people who are underinsured or uninsured, they rely on us to help them through the charitable care program. And for that, we rely on donations.
What if somebody watches this and they say to you, Sarah, I saw you talking about this, but money's tight for me right now. Are there some other ways I can help?
Yes, a really important way is we are always in need of volunteers, particularly volunteers who are willing to come to a patient's home, either in the patient's own home or in the hospice home, or perhaps at an assisted living facility. Volunteers truly are the heart of hospice.
Yeah, and do so much to help the families and support them. And do you have any fundraising events coming up? I thought that you had sent me an email one day about a big event that's coming up next month or something. Tell me about that.
We sure do. I'm so excited to talk about this. This is our first chicken stew fundraiser. It's a drive-through event. It's going to be on Thursday, October 28th from 4 to 6, and it's going to be held at the Woltz Hospice Home in Dobson.
Right. Making me hungry already, just mentioning that. Now, I'm assuming proceeds are going to go directly to helping support hospice, right?
Well, in this case, the proceeds are going to be split evenly between Mountain Valley Hospice and also the United Fund of Surrey County.
Oh, great.
Yeah, because the United Fund of Surrey County has been such a big supporter of us over the years.
That's right. Now, I want to remind everybody what Sarah just talked about with this event. It's a chicken stew fundraiser, Thursday, October 28th. It's from 4 to 6 p.m. at the Woltz Hospice Home in Dobson. And by the way, Woltz Hospice Home, a lovely facility, for people that either don't want to or can't be in their home, when they're getting care. But the Woltz Hospice Home in Dobson. Now, for more information, you can go to the general website, mtnvalleyhospice.org, or you can call 888-789-2922 to find out more information. And it's a great way to get in there and get some mouth-watering chicken stew and help hospice help others. Sarah, thanks for all you do for the community and have been doing for years.
Well, thank you so much.
All right, come back sometime, will you?
Okay.
We'll be right back. Back now on Triad Today, and once a year or so, we like to check in with our dentist, our resident dentist, Dr. Nick Capehart. He's with us here today, owner of Ardmore Dentistry in Winston-Salem. Welcome, sir. Good to see you again.
Good to be back, yeah.
Yeah. You may not know this, Dr. Nick, he once threatened to give me Novocaine before I started asking questions. That would have been a disaster. No, he didn't really do that. Now, seriously, let's talk about, this may seem like a stretch, but COVID is still with us. How has COVID affected and changed oral health?
Well, I'm sure people are tired of hearing about this. I mean, it's been going on forever, seems like. And, for us, the few things we've noticed, let's see here. The shutdown was roughly March-ish, April of 20.
Right.
And for a lot of our patients, if they had come sometime in the middle of 2019, it may be 2 years since we've seen them. So that brings into a factor of, just general checkups and making sure everything's okay.
Right, because you like to see people. Is it still the general rule you like to see people every, 6 months? Or
6 months, we could go into depth on where that number came from, but generally a couple times a year, and that just keeps us from getting behind problems.
Right.
And stay ahead of things. And then on top of that, the other issue is people stop going to work. Now, they didn't stop working, but they stopped getting up and getting dressed every morning, and they get out of their routine. And that's been a huge issue for us. And people, they get up and they jump on their computer immediately. And I know that's been beneficial for a lot of the companies that probably get more productivity out of their employees. But on the flip side, they don't brush their teeth the way they should.
Now, let's say they start to come back and to the dentist, start to make appointments. Are there any remaining dangers that we should look out for, both to the patient or to your staff?
So, of course, we recommend getting vaccinated. In our office, we decided to do that as soon as we could. For patients, from a standpoint, people don't realize this virus is transmitted via aerosols, and that is our business. I mean, we've been dealing with that since the beginning of time. And so our offices are set up, they're designed for airflow to clean the operatories. The way that they're segregated, we keep people apart so that they can't get exposed to others. And then, not to mention, our equipment is set up to gather those aerosols and to filter them and get them out of the office.
Right.
And so for patients, as for, of actually going to an office and getting in the chair and receiving care, there's minimal exposure to anything. I mean, outside of you're more exposed to going to the grocery store.
Right, right. Now, you sent me an email one day, and we were talking about large dental practices or these big corporate things versus the smaller family-owned ones like yours. And you were talking about how you adapt in a situation like COVID easier or quicker. What did you mean?
So a couple things. One, just the number of people. Like when we had limited, and again, trying to maintain interactions among strangers, we've got fewer people coming in and out the door. And I mean, you've been to the doctor's office where you go in and you sit and there's 35, 40 people sitting around you. And well, we try to, maintain a schedule so that you might see one person. You come in, you come out, and you go on about your life. Alternatively, you've got a lot less people that I have to worry about. Before the vaccine, I got a lot less people that we have to manage of where did you do this weekend? Where did you go? Were you exposed?
Right.
From a standpoint of, not to just keep beating on the subject, but the vaccine, got a lot less people that we have to kind of get on board with what we're trying to accomplish. And you saw what Navon has had to do recently.
With the layoffs and everything.
And that's,
yeah.
Unfortunate. But part of what we do is we come to the same philosophy. And with a smaller office, you get people gathered around a similar philosophy.
Right.
Which can be more difficult in a larger situation.
And we can absolutely say it's safe to go back and get your checkup. I mean, because as you're saying, you're almost pre-prepared for COVID just by the nature of what you were doing. Up on screen, I want folks to visit this website. WS Dentist stands for Winston-Salem Dentist.com. WSDentist.com, or you can call 336-760-9840. Ardmore Dentistry is located at 3165 Maplewood Avenue in Winston-Salem. So we hope that they will check out that information and not wait too long, even that. Dr. Nick Capar, thanks for doing this.
Thank you again for having me and listening to me ramble on for a few minutes.
You didn't ramble at all. We're glad you gave us some good tips there. We'll be right back after this. Back now on Triad Today, just about time for the round table, but a couple things. First of all, another shout out to the good folks here at Senior Botanical Garden. Their website is on screen. Hope you'll visit them. It's a great place. On a sad note, a friend of the show, Betty Lynn, passed away last week. She played Thelma Lou on the Andy Griffith Show, and she appeared on Triad Today back in 2008. We had a delightful conversation, and just a wonderful woman. She's irreplaceable, and we will miss her. Betty Lynn was 95 years old. Now to the round table. On my right, as always, the political left, Ogie Overman, the great broadcaster and journalist. Socially distant behind us, Taylor Woods, CEO of Ashtay Products, and Keith Granberry, founder of Helping Hands Consultants. Guys and gals, let's get to it. Winston-Salem City Council now says they're going to pay city employees a $1,000 bonus for getting a COVID shot, and even give the $1,000 to those who've already gotten the shot. Guys and gals, you okay with taxpayer dollars going to pay for someone to get a shot, Ogie?
No, I'm not. I wasn't really in favor of it to begin with when they started doing it. But now, if they hadn't figured it out by now, I'm not giving taxpayer. Let them go. Put them on a leper colony. I'm over it. I'm sick of it.
All right, Taylor.
Oh, I'm glad to hear you say that. I just think it's crazy. Quite honestly, if we're going to give taxpayer dollars to get a shot, I want a check. I want a check for my shot.
Right, because you already got one. We all got one. Keith, what do you think? $1,000.
I'm against both of those guys. I think the city employees aren't making a lot of money anyway. They're underpaid, so why not give them a bonus to do it, and maybe they can influence other folks.
You know, that's like a parent telling a 5-year-old, "I'll give you $100 if you'll eat your broccoli."
Yeah,
I mean,
but
they're
if you eat your
supposed to
broccoli,
eat it
you're going to
anyway.
be healthy. You're supposed to, but
You're
you're not.
supposed to. All right. Meanwhile, similar topic: police and firefighters in Raleigh now threatening to sue the city over COVID vaccine mandates. Now, let's do the flip side of this, guys. Instead of firing policemen who are essential personnel, so we say, okay, look, don't have to get the vaccine, but you've got to mask up 24/7 and get a test every week. Ogie, what do you think?
Well, I'd like to think that our police and firefighters had better sense than that, but since they obviously don't, some of them, they are essential. I don't want my house to be burning and some guy says, "I'm sorry, I'm off duty.
Yeah,
I
I'm
didn't
not
get the shot."
vaccinated either.
So
Yeah.
mask them up and make them test.
Taylor.
This one's tough. You know, I got the vaccine, but I don't believe in mandating it either. At the same time, I think people should have free will and choice. But, you know, getting tested every day, masking up is great. But then also, who pays for the tests? Because they are not cheap.
Key.
I think that while I don't agree with mandates, I think that people who are out in the general public or serving the general public should get this vaccine or they should not be working.
All right. Meanwhile, a Walgreens store in Indiana accidentally gave COVID shots to a couple and their 2 young children instead of giving them a flu shot. The children immediately experienced side effects, including some heart problems. Now, let's say the kids get over the side effects, everything turns out okay. The question is, should the parents still sue Walgreens? And if they sue them, would they win? Quickly, Ogie.
I think they got a case, but I think they were planning it. Side effects, that sounds a little trumped up to me. I'm a little sketchy about that, but they probably do have a case, and they could win.
Yeah, Taylor.
Yeah, I think regardless of the side effects, they should sue because at the end of the day, they went in for one thing, got another.
Got another one. All right. So it's a basic consumer problem then.
Yeah,
Key,
malpractice.
what do you think?
I think they should sue, and I think they're going to win.
The recent resignation of NFL coach John Gruden because of racist and homophobic emails dating back to 2006 begs this question, guys. Should there be a statute of limitations on using someone's past emails to justify firing them? Ogie.
Well, you got to know better. I mean, I just don't I hate that we've waived our rights to privacy, but still, somebody in the public eye, that once it's out there forever, pretty much. He should have known better. He's just stupid.
Somebody finds some emails that are objectionable of yours, Taylor, from 10, 12 years ago. They say, we're going to fire Taylor. I mean, what do you think? Should there be a statute of limitations?
I think there should be a statute of limitations. I mean, in the case of John Gruden, that's different. You know, some of that stuff was recent, but you know, going back 15, 20 years, there has to be a limit. There has to be a stop.
Key.
I think that there should be a statute. I think everyone grows. So, I mean, John Gruden 11 years ago may not be John Gruden now, but once you looked at those emails, he still was stupid. John Gruden, 10 years later, he still was dumb and racist and homophobic and all those things. But, you know, 10 years ago, if you did something, you shouldn't be held accountable unless it's something that deals with young people or
something
crime.
current. Yeah, something current,
yeah,
too.
Other than that, no.
All right, last week, Guilford County Schools had to recall a shipment of prepackaged sandwiches which reportedly contained spoiled meat. The sandwiches are purchased from a company out of state, which begs this question. I'm old-fashioned, guys, I know that, but shouldn't local school cafeteria staff be preparing all of the food that goes into the kids' mouths like they used to, Ogie?
Yes, I think they should. I mean, I hate the thought of these Stewart sandwiches being served to the kids. That's junk. That is total junk.
Taylor.
Oh, God, this question just makes me sick. I think everything should be cooked. And, hey, why not make it healthy? But apparently that's asking too much. We got to have prepackaged sandwiches from another state.
Keith, they've been buying this stuff for 14 years.
Oh, God.
And it's all been bad. I mean, kids come to school. Many of them, this is their only opportunity to get a healthy meal. They should be prepared at school by a nutritionist. Absolutely.
Right. Finally, last week, William Shatner, as we know as Captain Kirk from Star Trek, flew into outer space on Jeff Bezos' Blue Origin rocket. Now, normally it costs up to $500,000, $500,000 just to get on there. Of course, he got to ride free as a celebrity. But here's my question, guys and gals. If tomorrow you were offered a seat on that rocket to go into outer space for free, Would you go, Ogie?
I would. I absolutely would.
No reservations.
I would go. I would definitely go.
It's only about a 10-minute flight, but it does
I
go
would
in.
go.
Technically, it
I
goes
would
in outer
do it.
space. Taylor, would you go?
I don't even do Ferris wheels. I don't know about that.
So you're not sure. Keith, would you get in the rocket and go into outer space?
No, but I tell you what I would do. I would put you and Ogie in the rocket and send y'all up there. That's what I would do that.
I'm
Y'all
convinced.
tell me how it is.
Yeah. Now I'm convinced that Keith is from outer space. All right. Well, anyway, that's all the time we have. Oh, except for this. I just remember to tell you this. DC Comics late last year, as you know, changed Batman's buddy Robin, the Boy Wonder. They made Robin gay, and then a few weeks ago they said that Superman's son is going to be bisexual. They also said that Robin and Superman's son are going to team up to fight a new arch enemy, Coach John Gruden. You didn't know that, did you? For all of us here at Triad Today, I'm Jim Longworth. We'll see you.